Davao Doctors College, and today I am going to demonstrate the assessment of the cranial nerves. As we all know, nerves is very important because it helps the minute detail of our life, and if it is damaged, it can bring a permanent impact to our lifestyle. So now review the client's medical record if available, then determine the scope of the assessment if needed. This is done for us to be able to know the extent of the physical assessment. Then prepare the necessary equipment such as the copy, the Snellen's chart, the hand-held eye chart, the wisp of cotton, the tuning fork, the pen light, paper clip, the tongue blade, and of course, the patient's gown will help us save time and energy. And of course, don't forget to perform hand washing and use gloves if necessary. So now greet the client politely, introduce yourself, verify the client using the two identifiers such as his or her name, then birthday, and of course, ask how he or she would like to call during the assessment. And don't forget to establish a good rapport so that the patient or the client won't feel uncomfortable during the assessment. Then don't forget to explain the procedure to the client so that he or she will know how he or she can participate during the assessment and provide the client the opportunity to ask or raise for his or her concerns. Hi ma'am, good day. By the way, my name is Franz, your student nurse for today. So may I know your name? When is your birthday? So is that okay that I'm going to check for your wristband? Okay. So by the way, the procedure that I will be doing is that I am going to assess for your cranial nerves. So this is for us to know if you have any abnormalities present. I will be touching some parts of your body and there are some movements that you should follow. Is that okay with you? Okay, so by the way, do you have any clarifications or concerns? Okay, so by the way, can you see? I've closed the curtain so that there are no other people who can see us, and the information that I will be getting from you is secured and safely handed to the doctors. So let us start the assessment. So now let's proceed to the working phase. First, let's assess for the cranial nerve 1 or the olfactory. So Tia, I want you to first clear your nose. Okay. So now I want you to close your eyes and close one of your nostril. Okay, so I want you to smell this and I want you to describe the odor. Okay, bittersweet. So now the patient is able to describe the odor. So now let's proceed assessing for the cranial nerve 2 or the optic. So now Ate, I want you to cover your right eye. Then read this. Okay, you can start reading.
958742843 E right, E up, E left, 8 X circle 8745 E left, E down, E up, circle, X circle. 63925 E down, E right, E left, X circle X. 428365 E up, E right, E down, 0x0. 374258 E right, E up, E left, E right, XX0. 937826 E up, E down, E right, X00. 428739 E right, E up, E down, 00 circle.
Okay, so now I want you to cover your left eye and then read it again.
958742843 E right, E up, E left, X circle circle. 8745 E left, E down, E up, 0 circle, X circle, 639825. E down, E right, E left. X circle, X, 428365. E up, E right, E down. Circle, X circle, 374258. E left, E up, E left. X circle. 937826. E down, E up, E down, E right. X circle, 428739. E right, E up, E down, 0. Circle, X.
Okay, thank you. So now let's check for the visual acuity using the Snellen's chart. So now let the client stand 2 feet away from the Snellen's chart. So I'll say I want you to cover your right eye, then read this.
E F P T O C L P D P C F B E D F C C P F E L O P Z D D F P O T E C.
Okay, so now you cover your left eye.
A F P T O Z L P D P C F B E D F C Z P F E L O P Z D D F P O C P O T C E.
Okay, very good for that. So now let's check for the visual fields. So Althea, tell me if you can already see the movement of my hand. Okay. Okay. So the patient can see 20/20 near and far vision. For the third assessment, let's check for the cranial nerve 3, 4, and 6, the oculomotor, trochlear, and the abducens. So first check for the eyelids, they should not be obscure the vision, and check for the pupils should be round and equal in size. So I just want to check your... Okay, thank you. So now let's check for the pupillary reaction by shining a pen light to the eye, then observe for the direct and consensual reaction. So now place your finger about 10 cm away from the patient's face, then observe for the patient's pupil dilation. So Althea, I want you to stare at my finger. Okay. So lastly, check for the extraocular movements in the 6 cardinal direction of gaze. So Althea, I want you to look up right, up left, horizontal, then down right and down left. Okay. So now Althea, I want you to stare at this pen light, then follow the direction. Okay, thank you. So for the oculomotor, the pupils are round, equal, and reactive to light, and accommodation. So for the trochlear, both eyes move in the direction indicated as they follow the examiner's pen light. So for the abducens, both eyes are moved in coordination. So for the fourth, assess for the cranial nerve 5 or the trigeminal. The mandibular, maxillary, and ophthalmic division should be tested symmetrically for the pain, light touch, and temperature. So for the pain, use a Q-tip sharp, then ask the patient to close her eyes. So Althea, can you close your eyes and tell me if the pain are symmetric? Okay, thank you. So now, test for the light touch. Use a wisp of cotton. So Althea, I want you to tell me if you can feel the cotton. You feel it? Okay. So Althea, I want you to compare the pain. So the pain are similar. Okay. So now tell me if the Feeling or similar? So now let's check for the corneal reflex. So Althea, I want you to look up away from me. Then tell me if you can feel the touch of the cotton. Do you feel it? Okay. So the patient feels the touch from the forehead, maxillary and mandibular areas of the face. So for the fifth is to assess for the cranial nerve 7 or the facial. So normally the patient could do these maneuvers easily. So Althea, I want you to smile for me. Okay. Can you frown? Show me your teeth. Okay. So puff your cheeks. Press your lips. Raise your eyebrows. So close your eyes tightly against resistance. Okay. So as you can see, the patient can smile, frown, puff his cheeks, close his eyes, raise his eyebrows. So for the sixth is to assess for the cranial nerve 8 or for the vestibulocochlear. This is to assess for the hearing. So test one ear at a time and occlude one patient's ear with your fingers. So stand 1 to 2 feet away from the patient and conceal your mouth to prevent the lip reading. So whisper a number or words such as 99 or the baseball. Okay, so now Althea, I want you to repeat me or what have you heard from me. Okay? Okay.
99.
Okay. So now this.
Baseball. Baseball.
Okay. This.
Baseball. Baseball.
Okay. So now let's test or assess for the lateralization using the Weber's test using the tuning fork. So Althea, I want you to tell me if you can hear the vibration in your one ear or your both of your ears. Okay. So now let's perform the Raynaud's test to compare for the air and bone conduction. Place the vibrating tuning fork on the mastoid behind the ear. So tell me, Althea, if you can hear the vibration. Okay. Okay. So as you can see, the patient can hear the whispered words and the vibration of the tuning fork. So for the 7 is to assess for the cranial nerve 9 and 10 or the glossopharyngeal and vagus. So Althea, I want you to say Okay. So now I want you to open your mouth. So observe for the palate and uvula. So Althea, I want you to open your mouth. Say Okay. So test for the gag reflex at one side at a time. So Althea, can you open your mouth? And this might hurt a little. Okay. So now ask the patient to swallow. This might be done without difficulty and regurgitation. So Althea, can you swallow? Okay. Repeat it. Okay. So for the glossopharyngeal gag reflex is present. And for the vagus, the patient can swallow and speak without difficulties. So for the 8th assessment is to assess for the cranial nerve 11 or the spinal accessory. So Althea, I want you to turn your back and I will remove your gown. Is that okay? Okay. Okay. So now can you shrug? Okay. So evaluate the strength and the contraction of the upper trapezius muscle. After this, ask the patient to turn his head in both sides. So, Althea, can you look to the right? So, look at the left. Okay. Of course, can you look up, then down? So, of course, you observe for the contraction of the opposite sternocleidomastoid muscle and notice the force of the muscle against my hand. So, the patient can shrug her shoulders and turn his head side to side against resistance. So, for the 9 is to assess for the cranial nerve 12 or the hypoglossal. So, let's check for the tongue atrophy and the fasciculation. So, can you open your mouth, Althea? So, can you put your tongue out, then move it left, right, up, and down. Okay. Okay. So, as you can see, the tongue is in the midline and it can move without difficulties. So, now for the closing phase, inform the client that the assessment is done. Assist the client to change his clothes and position the client into a comfortable position. So the last thing is that summarize the information obtained during the working phase. Discuss the possible plans and actions to resolve the health concern, if present. Assess the client understanding of the plan and for further teaching. So provide the client to ask for his or her concerns and don't forget to thank the client for the time and effort. Don't forget to perform hand washing and document the findings to the client's record. So, hi again, Althea. So, for the summary of our assessment, it shows that you're all good and normal, and there are no problems for the assessment. So, if you feel uncomfortable next time, feel free to come back here so that we can run another assessment. And don't forget to maintain your lifestyle good, and of course your habits. So, do you have any clarifications or concerns? Okay. So, thank you for your time and cooperation and have a nice day.